Welcome to our virtual tour of the brand new Samaritan Pacific Communities Hospital in Newport, Oregon. I'm Leslie Ogden, Chief Executive Officer of our two Samaritan Coastal Hospitals.
And I'm Jane Russell, the Chief Operating Officer here at Samaritan Pacific Communities Hospital.
Thanks to our wonderful community, the Pacific Communities Health District passed a $57 million bond measure to create this amazing facility. Because of the pandemic, we are unable to have an open house celebration, so you could see it all firsthand. So in lieu of an on-site tour, we are taking you on a virtual tour, so you can see the new community hospital that you helped create. Ready, Jane?
Let's go. Hello and welcome to our operating room suite. As you can see, we have quite a bit of rooms here, and I'm going to walk you through and explain what you're seeing. These rooms here are our pre and post operating rooms where we monitor our patients and make sure that they are doing well after surgery. And we also bring them in there before surgery, and that's where they'll meet with the anesthesia crew and the surgeon before they go into the operating room. So in this suite, we have 14 rooms, and we are, for a small hospital, we're quite busy. We do about 280 surgeries a month. And we do all types of surgeries. We have elective and emergent surgeries. This is where our patients go through to the operating rooms. We have 4 operating room suites. Unfortunately, we're not going to be able to show you what's behind the door because that red line means that it's sterile.
We're now in the Diagnostic Imaging Suite. This is an area that allows us to take imaging pictures of different kinds depending on what a patient might need. So a patient from our ER who might need a specific exam on our CT scanner that you see behind me. This is a computed tomography scanner that allows us to see inside the body, essentially. We also have things like MRI. We have 2 ultrasound machines. We have a DEXA scanner, a mammography machine, and multiple avenues to take plain X-rays. We also, and finally, have a nuclear medicine machine that allows us to see human organs in action, things like the heart and liver as they're actually functioning.
We are currently standing in our emergency room. This is one of our trauma rooms here, and our emergency room is quite busy. We see about 16,000 patients a year in 15 rooms. We are open 24/7. And an interesting fact is that we do have a helipad right outside our door here. So patients that need care can get on a helicopter and go to a higher level of care anywhere in Corvallis or the Portland or Eugene area. One thing to note about our organization is that we were recently awarded the American Heart Association Gold Plus Stroke Award for our excellence in care with stroke patients. One of the improved design features of this new hospital are these long hallways that transverse the length of our facility outside of the public areas. So in the past, when people came into our hospital, all of the things like linens, supplies, and food had to be brought through where patients were. Now with this new design, our staff can transverse the hospital with all of these needed supplies without bumping into patients.
We've come onto the second floor of our hospital, and what you'll notice here is that we have been able to, over this entire floor, unite the vast majority of our clinics in the Newport area. We've got it divided into 3 separate parts, one for primary care, that's designated by the blue color here. Next, we have pediatrics and women's health, that's designated by a rust color orange, and then finally, at the end, we have our surgical services designated by the green color. What you can do is come into any of these areas and see your primary care provider or your specialist, and you'll be taken back into the clinic area, but this is one united waiting area for all of these services. The other really nice thing is that all of the providers that work in the back can consult with each other over a patient's care. And all of the hallways in the back connect to one another, so there's not any walls separating all of these clinic areas from the staff perspective. One thing that's particularly unique to the green area is an X-ray unit that is specially set up for that clinic so that patients do not have to go downstairs for their X-ray to the diagnostic imaging area. Instead, they can get their imaging right here in the clinic.
I'm currently standing in one of our inpatient rooms. We have 25 inpatient rooms here in this hospital, and they are all private. Most of them have a view of either the ocean or the bay. We're standing on the ocean side currently. Another interesting fact is that a lot of our rooms can convert to either acute care or ICU care. So that allows us to have flexibility in our community to care for patients for whatever their needs are. Our hospital was designed with a lot of consideration for our patients. Often when you're hospitalized, you don't have a lot of privacy, and you also need to rest, and a lot of the noises from the hospital sometimes are really impede that. So one of the unique design features that we did in all of our rooms are these pass-throughs, and what I'm standing in front of here is drawers for medications and supplies, as well as trash. And what you don't see is that on the other side of this door there are doors that open on the outside. So when our environmental services staff comes to change your trash, they don't have to come into your room. And when the staff come to stock the drawers, they don't have to come to the patient room either.
We're now in the birthing center where mothers come to give birth. We have 3 full labor and delivery areas where mothers can spend their time prior to delivery. There's areas for family to join them. There's areas where they can take a bath and really enjoy having their family around them. And there's areas for both the health and safety of the mother and the baby, including a neonatal resuscitation area in each of these suites. We have a triage area where mothers are evaluated prior to coming in to the birthing suites. And we have a C-section suite where a mother can quickly and easily be taken right across the hallway to have a cesarean section, either emergently or electively. In addition, we have a surrounding area, including a nursery and a waiting area that lend to the family atmosphere and the beautiful birthing areas that are available. We have 2 rooms right outside the proper unit that can also be flexed in case we have lots of mothers and babies at one time.
I hope you enjoyed part 1 of your virtual tour. In this video, Jane Russell and Dr. Leslie Ogden took you through the Samaritan Pacific Communities Hospital's newly built 3-story building, which was complete in early of 2019. In part 2, they will guide you through the 2-story building of the hospital, which was finished in March of 2020. This was a part of the new hospital's existing structure, originally built in 1988, but renovated as a part of the new hospital project. During the renovation, the building was seismically upgraded to withstand a magnitude 9.0 earthquake, which is essential here on the coast. Many of you helped to equip this new facility through the foundation, and for that we are forever grateful. Through the new hospital project, we are truly building healthier communities together for generations to come.